Welcome to the Legal Helpline program. I'm Tony Noakes, and joining us today is Dr. Wendy Walsh. The purpose of our program is to inform viewers about the health risks presented by products that have been found to be potentially dangerous. Today's topic will be of special interest to any of our viewers or their loved ones who have taken the type 2 diabetes medication Ozempic for weight loss and been diagnosed with gastroparesis, diabetic retinopathy, kidney problems, pancreatitis, low blood sugar, serious gallbladder issues, or thyroid cancer. Dr. Walsh, thank you so much for joining us today.
Thank you, Tony. I'm pleased to be here.
How did its use for weight loss come about?
Well, the short answer, Tony, is that there's a tremendous market for people with weight issues who are not diabetic, but who are looking for an easier way to lose weight through the normal channels, diet and exercise. And this demand has resulted in what's estimated to be millions of prescriptions being written for non-diabetes patients who have weight issues because it does cause weight loss, right?
Dr. Walsh, given the problems associated with the medication that we will be discussing today, and the fact that Ozempic is not approved as a weight loss medication for non-diabetic patients, how is it being prescribed?
Well, the simple answer is that drugs can be prescribed off-label for another use as a side effect. In this case, since Ozempic is basically the same semaglutide-type medication as Wegovy, which was approved by the FDA, the manufacturer was allowed to prescribe Ozempic off-label for people living with type 2 diabetes and obesity.
It's sounding like the weight loss side effect of Ozempic has made it a go-to medication for anyone who wants to lose weight.
Oh, that's definitely the case. In fact, recent reports indicate millions of prescriptions are being written. So many that there's a shortage of the medication. And unfortunately, Tony, there appears to be more to the story when you consider the possible side effects now being reported.
Okay, tell us more about that.
Well, according to a study just published by the American Medical Association, popular weight loss drugs like Ozempic could increase the risk of a number of serious gastrointestinal conditions. This was the first large epidemiological disease-related study to examine adverse side effects in non-diabetic patients using these drugs specifically for weight loss. Now, this was according to a press release from the University of British Columbia. The risk was linked to all semaglutides, a class of GLP-1 agonist medications, including Ozempic, that have been prescribed for weight loss. Now, in this study, researchers examined the health insurance claim records for approximately 16 million U.S. patients who are prescribed Ozempic, 16 million, and other semaglutide medications across a 14-year span between 2006 and 2020.
And what were the results of the study, Dr. Walsh?
Tony, I gotta say, the results were quite alarming. Compared to a non-GLP-1 agonist, those who took a GLP-1 agonist, such as Ozempic, were almost 4 times more likely to develop stomach paralysis or gastroparesis, had an over 9 times higher risk of pancreatitis, and were over 4 times more likely to have a bowel obstruction.
Now, for a viewer to be exposed to this type of health risk after using a product they have the right to think is safe is really hard to understand. So hopefully the information you have provided today will be of some comfort to any of our viewers or their loved ones who have been diagnosed with any of these serious diseases after being prescribed Ozempic. Thanks for being here today.
Thank you, Tony. It was my pleasure to be here.
And thank you for watching.
Have you or a loved one been diagnosed with gastroparesis, diabetic retinopathy, kidney problems, pancreatitis, low blood sugar, allergic reactions, serious gallbladder issues, or thyroid cancer? After taking Ozempic for weight loss, you may be entitled to significant compensation. Recent lawsuits filed allege that Novo Nordisk, the manufacturer of Ozempic, a new class of medicine known as a GLP-1 agonist prescribed to manage blood sugar levels for people with type 2 diabetes, failed to warn patients about the risk of severe stomach problems associated with Ozempic. Although the drug slows down digestion, keeps food in the stomach longer, suppressing hunger, leading to weight loss, serious side effects are alleged to be occurring. If you or a loved one has been diagnosed with gastroparesis, diabetic retinopathy, kidney problems, pancreatitis, low blood sugar, allergic reactions, serious gallbladder issues, or thyroid cancer, after taking Ozempic, you may be entitled to significant compensation. Call now for a free case review.